And I'd like to continue by introducing the WheezeScan itself, and I'll show it to you. This is the WheezeScan. It's 12 centimeter long, and I will show it to you later during my presentation and show you what kind of things you can do with it. What I would like to state very clearly, it is a new tool to help parents to confirm wheeze. So it really is meant for parents and not for doctors. This is already shown by you by Costas, the stethoscope, which was invented about 200 years ago in the Necker Hospital in Paris. And what you can see about it, it's called the old warrior of medicine, and I think lots of you will agree that with me. Where I would like to start is this already somewhat older study from Fernando Martinez, and the title of the study is Prognosis of Early Childhood Wheeze. And what many of you know is that he started a birth cohort of about 1,000 children, and after 3 years, it appears that 1/3 of these children had wheezing during one period or more periods in their life. And he followed that group until their age of 22, but initially to 6 years of age. And he found that of these 1/3 of the children that wheezed during their first 3 years, in 60% of the children, the wheeze disappeared again. And he called it transient wheeze. And in 40% of this group, wheeze persisted, and these children were in most cases diagnosed as asthma. Then there was the no wheeze group, and they were followed up also 6 years, and a group that never wheezed, 77%. And then a smaller group, late onset wheeze, and that was also a group where in the majority of the cases that were diagnosed as having asthma. This is a very important study, but what you have to know about it, it's very nice, but you can only use these terms in retrospect. It doesn't help you if you are in your office and you see a wheezing child in front of you, and it doesn't give a clue about the future of the wheeze of this child. And this is what we know about wheeze. 1 in 3 children wheeze before their 3rd birthday. Cumulative prevalence of wheeze at age 6 years is 50%, and it's quite an expensive disease. Preschool wheeze utilizes 0.50% of the total healthcare budget from the United Kingdom. We have a rather long differential diagnosis of preschool wheezing, and only a few of these diagnoses occur frequent. Of course, recurrent viral upper airway infections, of course, asthma, post-viral wheeze, especially post-viral wheeze after respiratory syncytial virus infection, and also wheeze that occurs in preschool children after they have been exposed to cigarette smoke. And then there is a rather long list, even longer than I put up here, long list of rare diseases. So these are the frequent ones. Then we know, and Bulland have showed it very elegantly, wheeze may be interpreted differently in the first place because of differences between observers, parents versus healthcare providers versus doctors. Wheeze can be interpreted differently when reported retrospectively versus real time or prospective, and other factors may also play a role, such as the environmental context and the cultural context. What for us is important is the agreement between parents and healthcare providers. And this was a study that was shown already, and this study showed that in 55% there was disagreement between parents and physician assessment of wheeze in children. And a somewhat later study from 2004 from the group from Lowy that found that lung function in children with physician-confirmed wheeze was significantly lower than lung function in children with only parental reported wheeze. And that indicates that maybe if physicians establish the diagnosis of Wheeze, confirm Wheeze, that means that maybe these children are worse off later in life. Another thing that we use in our daily practice is predictors for asthma. And what we know up to now is that predictors for asthma may give an indication. And we know a few. History is a predictor, especially the family history with respect to allergic diseases and asthma. Maybe physical examination, maybe if Wheeze is confirmed by the doctor, that may be maybe a predictor for asthma later in life. The same holds true for non-invasive measurements such as exhaled NO, serum markers, specific IgE, certainly in relation to a history of allergic disease, is a predictor for asthma, and maybe also findings of biopsies. Predictors for asthma may differentiate between groups, but in all these cases that I mentioned, they increase the chance to develop asthma. However, there is overlap between the groups that were investigated, and up to now, there is no diagnostic available for daily practice, and certainly not for parents. What I would like to do now is step to the WheezeScan, the new development. And again, I'll try to show it to you again. It's 12 centimeter. Up here you can see the membrane. There is only one button on it. It has a Bluetooth receiver, and it has two indicators, Wheeze, a LED light that could light up, and an indicator of no Wheeze. And it detects Wheeze for patients of 4 months to 7-year-old. It consists of this handset with a built-in microphone. You can place it under the right collarbone to detect, I don't know if you can see it, this is where approximately my right collarbone is. It detects a wheezing sound, and as I told you, it says Wheeze or no Wheeze. So it's quite a simple device. Omron Healthcare has created this unique center and the algorithm that can detect the presence of Wheeze. Here you can see the different phases during the development. Breathing sounds were recorded. There is an algorithm that identifies Wheeze versus other sound, and then, maybe even more important, a machine learning algorithm that increases accuracy with every new data point. The development phase, lung sounds were detected, pre-processed, and put in a three-dimensional parameters spectrogram. There was a feedback loop, and the parameters were added and memorized in the algorithm. And then there is the usage phase. Again, of course, it started with the lung sounds, pre-processing, and then there was a calculation, the probability that the sound that was heard was Wheeze or no Wheeze. Then the algorithm detects abnormal sound within the red line as Wheeze based upon the Corsa guideline, and all the other lung sounds were looked at whether they could be used in the Wheeze spectrum or not. And the reason that it was done, that this would make it safer to detect Wheeze. After this initial phase, a second phase started, and that was performed by people of the University of Madison in Wisconsin. It was validated among children suspected to have asthma or bronchitis. There was a comparison done between two groups, wheezing subjects and no wheezing subjects in 3 age groups, 3 months to 2 years, 3 years to 5 years, and 6 years up to and including 13 years of age. And each group contained 100 children. And this was, of course, a very important step in the validation of this device to look at the sensitivity and the specificity. And you can see here the sensitivity is 0.95%, and the specificity is 0.90, which is really nice. These are the people and the hospitals in which this validation phase took place. Great job what these people did. And then I will come to my last slide. In the first place, the WheezeScan, which is very easy to handle. Again, here you can see what I told you before. The on-off button, the only button of the device, the indicators for wheeze or no wheeze, and the receiver and of the Bluetooth. What I have to tell you is that it does not replace the stethoscope. Stethoscope is a tool for physician, and this WheezeScan is a tool meant for parents. And parents shouldn't be bothered with a stethoscope. And the second thing I have to tell you is that it does not measure severity. From the physicians that use this little tool already in their clinic and outpatient clinic, we know that the scan detects wheeze, but even if you have given a number of times a bronchodilator such as salbutamol or albuterol, it's still, if the wheezing sound is very weak, it still detects this sound. So you cannot use it to measure the severity, for instance, of an asthma attack. In the last slide that I will show you, there are apps to support this new tool. You can download them for free in the App Store if you have an iPhone, or in the Play Store if you have an Android telephone. It automatically syncs with the WheezeScan device, and the app is compatible with the device parents get. There is a notification function that can remind you to give the medication the doctor has prescribed. Parents can record major symptoms in the app, and of course this is all meant to make communication with your doctor easy and more clear. Okay, thank you very much.